Hey, everybody. This is my program proposal. I'd like to propose a continuing education course for dental professionals, specifically whole dental teams. The subject I chose is communication. I chose that subject because I think it's invaluable. In dentistry, we're really good at learning about all the newest materials, treatment techniques, technology, or anything related to the science of the profession. The soft skills aren't always a priority. That's why I've chosen to focus on this very important skill and how we can use it to improve our everyday practices. The outcomes of this program are both for the benefit of the patient and the practice. The most important patient outcome is their improved oral health literacy. That is what a lot of the other markers depend on. Because if their oral health literacy improves, then their oral hygiene practices will likely also improve. As well, they will become more likely to schedule for regular preventive visits and accept any treatment that the dentist proposes. Increased treatment acceptance is one of the most desired outcomes for the practice, but closely followed by a decrease in patient attrition. A major communication hindrance is the use of stigmatizing language, so to see a decrease in that would be another way to measure improvement. Finally, I think that with improved communication will come improved employee morale, which can also impact the success of other outcomes. Like I said, participants will be all the members of the dental team. That's to include dentists, hygienists, assistants, administrative staff, and more. I'm going to have to take into consideration that all of those professionals will have varying backgrounds and prior education. Even though not all the participants will have taken courses in communication, they'll at least have experience with it. So, considering Bloom's taxonomy, I expect that almost, if not all, the participants will be at least at the remember level of the cognitive domain when we start. Another consideration is how the participants will use the material. So, in patient communication, dentists discuss different things with patients than an insurance coordinator would. I'll have to take that into consideration when I plan the program and make sure that the communication needs of each member of the team are addressed. Then, when I consider interpersonal communication, I definitely want to be mindful of the hierarchical nature of dental professionals. While team members may have personal relationships, there are certain professions that indirect patient care anyway, have wider scopes than others. That can sometimes bleed into feelings of superiority or inferiority. I'll consider dynamics like that in my planning. The best way to assess whether there is a need for this program is by asking two pretty simple questions. First, is poor communication affecting patients' health? And second, is poor communication affecting the productivity of the practice? There are a couple of steps to take in order to assess those needs. An easy way to assess those needs is with the reports from the office's dental software. An office manager could easily pull them to show how many patients have unscheduled treatment or have lapsed in their preventive visits. Unscheduled treatment and irregular preventive care can impact both patient health and practice production, so it's definitely a good place to start. But those alone don't imply that poor communication is the cause. So, to further assess the need, questionnaires need to be sent to the patients. That's where the details can be sussed out. Are poor communication skills increasing the patient's anxiety, which prevents them from scheduling for regularly scheduled care? Is the problem in how the words are presented, or is it the words themselves? Questionnaires can also be used to determine potential negative interpersonal communication patterns. Again, is it the words and how they're presented, or is it the words themselves? In order to determine if there is a need, I'll have to work with the practice owner and office manager. They'll be the ones to determine what is acceptable amount of unscheduled treatment and if the poor interpersonal communication is enough to go through the course. A big obstacle for my course is going to be participation time. Because of the subject matter, this program can't be asynchronous. I plan to offer it on weekdays as well, which means that in order for everyone in the practice to be able to participate, they'll likely have to close the office for the day. To counteract that, I'm going to make this a hybrid model. I will create an online portion that will cover all the concepts that I want them to understand. Then there will be an in-person portion, which will be more interactive. There will be 4 modules in both online and in-person sessions. The in-person material will help them to build on what they learned in the online portion. Most of my objectives aim to get the participants to the application phase of the cognitive domain in Bloom's taxonomy and in the organizational level of the affective domain. There are no psychomotor objectives. The learning theory that aligns with my course is constructivism. As I mentioned earlier, everyone will have some concept of basic communication and a lot of experience with it. So my goal is just to facilitate them as they create new understanding of the concepts. I also want them to be able to find ways to incorporate them into their daily practice. The online material will be delivered in an interactive presentation, including video demonstrations of where the concepts can be seen in dentistry. I plan to utilize mastery checks and matrix activities to gauge the participants' understanding of the material. During the in-person portion, the instruction will be more hands-on. I plan to use problem-based learning to create a poor communication case study for participants. They can pair up with each other and create a presentation using the concepts they have learned from the material. That will be the main assessment of their learning. The 4 instruction modules I've created are listening, nonverbal communication, verbal communication, and practice-specific communication. In the listening module, the goal is for the participants to give examples of when listening is important and to demonstrate active listening skills both with a patient and a coworker. During the nonverbal module, the participants are to demonstrate how a patient might nonverbally communicate with a professional. As well, they will be able to describe how professionals might nonverbally negatively impact a patient or coworker. In the verbal module, the goal is to demonstrate the use of patient-appropriate words and phrases. They should also be able to demonstrate motivational interviewing as an alternative to oral hygiene instructions that come off as shaming. Finally, they'll be able to implement alternatives to stigmatizing language that hinders a patient's oral health literacy. During the final module, participants will focus on interpersonal communication. They will be able to identify where communication breakdown may occur, rephrase defensive language into supportive language, and commit to implement psychological safety concepts into their practice. Evaluating the effectiveness of the course will again take reports and questionnaires. Assessing treatment acceptance rate and preventive care scheduling will be an indicator for many of the desired program outcomes. They can compare the amount of unscheduled treatment from the needs assessment report to the rates at least 3 months after the program. Ideally, there will be a 10 to 20% decrease in unscheduled treatment and preventive care. Tracking preventive care appointments is a good way to track patient attrition as well. Another way to evaluate improved oral health literacy is when assessing oral hygiene improvements during preventive appointments. Improvements can be documented at each appointment, as well as tissue assessments that track markers such as inflammation and bleeding. Questionnaires will be used to measure whether or not the reported improvements can be correlated with communication or not. They will also be the best tool to assess employee morale and use of stigmatizing language. This program will be offered for a fee of $100 per participant. The cost will be used to cover the resources for the program, which consist mainly of refreshments and CE recognition fees. I plan to use free online platforms to present the material for the course, and I believe that the dental practice will be able to meet the technology needs for both the online and in-person presentations. I'll budget about $200 to $500 for lunch for the participants during the in-person portion of the program. The next major cost will be my CE recognition fee. The initial fee is $1,179, and then it's $754 to reapply each year. I plan to present this course at least 6 times per year. So that means the first year there will be no profit until about the third presentation in order to make up the initial fees. And then each course after, I'll have to set aside about $126 to cover the renewal fee. As I mentioned, my biggest challenge is participation time. When I market this course, I will need to present it so that the practice owners see that the long-term benefits will outweigh the loss of time and production it will take to engage in this course. My primary target will be my current office. After that, I will take it to friends that have work in other practices. My biggest selling point is going to be to show them how investing in better communication, which is so much cheaper than new flashy dental equipment that costs thousands upon thousands of dollars, how that communication will improve their practice production rates with significant return on investment. Overall, I really enjoyed working on this project, and I look forward to continuing my research and potentially presenting this in the future. Thank you so much for your time.